Relax, baby.
That right there.
She's going to tell you what to do, Jones.
So relax. So part of the relaxing part and the introduction to the Yonka ritual is really just kind of cocooning the client. Just making them feel relaxed. Introduce yourself to the body that it's going to go through some touching. It's not so much of a shock. How's that feel? Other than your shoulders are up by your elbows, up by your ears. So I'm going to have you guys tell me what the next step is, just so you guys can call it out. Next should be preparing, mixing. Don't do that.
Don't do that.
No.
Neck and decollete.
Décolleté.
Décolleté massage. Stretch.
Begin. Oh. What was that? Are those your glasses? Yeah, it's okay.
Now just relax, take advantage of the treatment.
Right? I remember Luce did a treatment on me in here, and she had all the estheticians, and I was so tired. And she was doing the microderm. I sacked out. Microderm. I'm done.
So we're going to do the neck. You guys, the estheticians also do this. The neck, we do the décolleté stretch. That means we just stretch from side to side. Massage therapist, you guys can pull up through here. Be careful not to pull too much on the neck. You guys know that more than anything. Now we're going to do our signature foot compress. We're going to take one towel. Francis' hot towel cabin works very well.
Signature
That
diagram.
hot towel can be hot.
Signature diagram.
I'm just going to expose her feet like this. Sorry, it's warm.
Sorry.
We're going to press up. I'm going to press down. Asking if they have any joint discomfort prior to doing this. Press up. Press down 4 times. And now you can do it individually foot, or you can do it at the same time, again, whatever you're comfortable with and on the timing. But we're going to press in, we're going to press out. We're going to do 4. So you guys can see. And getting the heel. You can do 2 passes. Again, always asking them if they're comfortable with their feet being touched. And then pull, and then you can massage in between here. Pull, massage. You might hear some popping. Again, outside, inside to outside. Between the toes. Very sorry about that. So that is our foot compress. Do you feel relaxed?
Yes.
Let me turn it off. Or that somebody's in here. Now we're going to mix. What's the next step?
Okay, so you've done the foot massage. Apply
152.
152, gobble 190 mixture to the entire back of the right leg, focusing on the thigh. Massage with 6 firming techniques.
Okay, so now we're going to have her go prone, but I want to show you how much.
You don't cover the feet, or you're still walking in the feet.
She's going to turn over anyways, so you can cover it if you want to, but if you want to feel her feet are pretty warm. So I don't want to overheat her. But it's up to you if you want to cover the feet or if you don't want to cover the feet.
Yeah, I'm sorry. Have client turn over on stomach and start the firming technique. So.
So I'm gonna have her turn over anyways. So it's really sometimes it's gonna be, but I want to show you first the mixture of it. So we're gonna use 2 tablespoons of Keto 152. That is gonna look like about that much. And what's the second mixture after that?
Gobble.
190.
Gobble
3 pumps.
190.
3 pumps. So gobble 190, but liquid form again, firming and hydrating the hops and rosemary. So we're gonna do 3 pumps. So we put pumps down. One, 2, 3. And it should be 3 pumps of wheel core 2, correct?
It doesn't say that. It says for the firming technique, it just says 2 tablespoons of 151 and 3 pumps of gobble.
We're good. We'll get to that. We'll get to the wheel core 2. If someone is really dehydrated, go ahead and mix in a 1 pump of wheel core 2. We want firming. But some people, you guys have experienced, have you ever experienced where you've, all of a sudden they have just soaked up even like straight shea butter. You're like, oh my gosh.
I'm sorry, what do you want to add to it if they're
Wheel core 2.
Wheel core 2,
Wheel core.
just 1 pump. So now I'm going to have her turn over, and then we're going to do the firming techniques.
Just 1 pump of the number
1
2.
pump.
Okay.
Do you want to put up the face cradle?
For the body treatments, if you want to, for the body treatments, we just have them lay on the side. It's up to you, comfortability. Do you want to lay on the side or do you want your face in the face cradle? Okay. Generally, we just have them lay side. They're not going to be down there for more than maybe 10 minutes.
Okay.
And have you turn over, just turn to your side. Excellent. Now we're going to go over the firming technique. So the lower left limb or the right limb, whichever you'd like to start. Are you comfortable? Mm-hmm. Take your mixture. And I'm just going to have you set that right there. And I want you guys to tell me what each move. That way I figured if you guys, I like to teach as if you tell me, then you can see. So you speak it, you see it,
Sure.
touch it. So what's the first move?
Deep rapid abdominal stance.
And you didn't put so much in your hands. You just,
No. So I just literally put about that much in.
Okay.
It's gonna be very, very light. Do you want to feel the texture of it?
Fingertips.
Milky.
Very milky, very light. And this is, you see, this is covered her whole leg. We don't want it to be very oily. The next,
A knuckling crawl.
the knuckling crawl. So the knuckling crawl is going to be this. Again, you with good body mechanics, it's better to go to the side and work up.
Slapping, upward movement, hands roll, alternate.
So, how does this feel? So we're moving with the F.
So we're not gonna do the gluteal area?
If you
Or
want
is
to,
that
you
later?
can. You
Okay.
can do the glute area if you want to. That's perfectly fine. We are only going to go to probably about right there, to about
Okay.
up to the hip. But if they want the glute inside, that's completely fine. So, how does this feel, even though I'm stopping you?
Feels good. Yeah. Not painful.
Hand over, hand over, hand over. When it said in the description inside out, I like it that way, but you can go inside out. Next,
Bear paw.
bear paw. So bear paw is literally just kind of raking like this. And the next one,
Slapping, beating.
slapping, beating. So we're doing more very, very, very. Should be pinching after this, is that correct?
Correct.
So is it more of a karate chop?
This is more of a karate chop, so it is just a little bit different, just a little bit at a faster rate. You can do one pass if you want to, you don't have to do two. Remember, we're a very French-based company, so. And then the pinching is this. So make sure I'm turning it down, everybody can see.
Bigger.
Bigger, so I'm literally like this. I'm not this.
More like a, you know,
Claw.
claw,
Yep,
crab claw.
exactly. Now you're gonna feel it's gonna get very tacky, and that's what I want it to get. You can do a pinch, I've seen a pinch technique like this. Pinch up and then bring back down. Pinch up, bring back down. But I like the bigger pinches feel better. How's that feel, pinching?
Good.
Do you like the bigger or the smaller pinches?
I think it depends because my calves are tight, so the small one, like when you rigged it felt good in my calves.
Okay.
That's the only reason why. Probably in the other parts of my body, the big ones would feel better.
So we're gonna go up this way. And that's it. And then it should be long F4 strokes and release, correct?
Firmly moves, continue the back of the body, left thigh, back torso, then flip and counter face up.
This, when I talk about, this is what I was showing guys. I just gave it to her. I just gave it to you and said, this right here, this gives you the
Oh, okay.
technique.
Is that what you're looking at?
Yeah.
I'm sorry.
It's okay. They're on both pages.
Okay.
This gives a little more in depth. Those are your cheat sheets.
Okay, yes. Deep and rapid effleurage strokes, yes.
Okay. So we're going to finish with and that's it for one side. We're going to go to the other side.
Can I do it?
You want to do it?
Yeah.
Yeah, absolutely. So long, deep effleurage strokes. Oh, there you go. Just come in on the other side, get out of your way. Now we're going to do kneading with the flanges. Nope.
Nope,
Kneading,
I'm sorry.
kneading is with these.
Oh,
with
I'm
these
sorry.
guys.
It's in the middle. It's okay.
Like we're kneading the bread.
How many times?
Anywhere from 1 to 2. You gotta remember your time. So
What's the pressure like compared to hers?
Yours is harder.
Okay. Is that a bad thing?
No.
Okay.
you can check with your client. Firm, light, pressure, that's completely fine. Effleurage strokes with release. Sorry.
I'm sorry. Like this?
Slapping.
Yep.
This
Nope.
is loud.
Oh, the slapping.
You guys have
Slap.
slapping. That one. Sorry,
Slap.
that one has slapping. So go ahead.
Slapping?
Good slapping. Yeah. Sometimes you have to turn your body. Going up like this is a little hard on your wrist. Do a little more hand over. One hand over. There we go. All right.
Okay. Next.
What's next?
Bear paw.
Bear paw.
Okay. Bear paw was.
This side.
I was coming up.
Yep. Kind of raking up.
Is that too hard?
No.
Okay. That sounds tentative.
I'm listening to the training. So.
And then next would be
This, slapping, beating.
slapping, beating. Right.
Okay,
So
and that
we're gonna do
was-
more. We're gonna do more of this.
Okay.
Yeah, go there.
Oh,
Yeah.
like,
Everybody.
So is the progression of the strokes like from a little lighter warming up to deeper?
Yep.
Okay.
Correct.
It's too much faster or not too much?
It hurts to go a little bit
It's
faster.
faster?
Yep.
So you like to start from the feet and then go up?
Everything up to the
circulation.
heart.
Everything goes to the
Everything
heart.
goes Okay. upwards. Okay.
Just like with the dry brushing, towards the heart.
Okay.
Now large pinching movements. Yeah. There we go. Excellent. You still feel it's tacky? You still want to keep it tacky?
Mhm.
You need something to grip. If you had too much slip there, it would feel very not as comfortable.
What are you doing? Oh, the pinching. Okay.
Okay.
And then
Effleurage.
last is large effleurage strokes with release. Up, release.
With this close,
Huh?
with this is close,
With-
finish.
This is yeah. So yeah, this would be kind of yeah. You're finishing like I've done beating you up. Now I'll treat you with a little bit of kindness. So who wants to do the back? Is there you want to do the back too? Does anybody else want to do it?
Is it the same way?
Yep, it's the same way.
Anyone? Anyone?
I'll
You
She's
try.
want-
gonna do it.
Go.
I'm video.
All right. So rapid deep effleurage strokes. You're going to go down, just like you would do for the back. Deep effleurage strokes. You're just doing it on the larger part of the area. I would make sure you come down all the way on the side here because when you're going to pinch, you're going to pinch this way. All right, now let's do kneading with phalanges.
So you
So I
can,
can pick one side and then
You can pick on one side if you want to. You can go do exactly. I would go just more in one of a stroke, just in one row, and then go back, and then one row and go back.
How does this feel? Good.
All right, next should be, what's the next step?
Slap.
Slap. So you're gonna go from side to side. So I would go side. Be careful because slapping in here is very sensitive. So just be careful. So you have hand, nope, 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 nope. Hand over fist. So when you cup like that, that hurts. So go over, one hand over the hand over, hand over, hand over, hand over, hand. Like that? Yeah, better. Just a little bit more. Use more,
more
surface
fingers.
areas.
There you go.
How does this feel? Yeah. I'm actually.
Do it a little bit harder because if you hear that, that's, there we go. I want more of a tap. I want to hear more of a tap movement. Hand over hand. Good job, better.
We're gonna cup our hands a little bit doing that or no?
No, you kind of need to do either your full surface area, because
Okay.
if you cut, that hurts. That little area right
Okay, so
there.
no cupping. I thought you said you
No cupping. No cupping. You just want to go fast. It kind of looks like you're cupping, but you're using more of this, or you can use more of your surface area.
Segunda.
Cupping, that hurts like that, and that creates pressure.
So that feels good. Yeah.
Hand over hand.
So you're pulling it towards you.
Yeah, pulling it towards you. So go like 1, 2, 3, 4.
There you go.
Go at a slope until you get that red mattock. So 1, 2, 3, 4.
There you
Correct.
Ah, I'm tripping.
I know it's hard. Just
It seems weird when you're starting
Yeah,
on the
right.
side that's closest.
Right.
Couldn't we do that other side opposite? Pull like from side?
You can go from side to side to side. I mean, you can come this way
Yeah,
towards yourself if you want to,
and
or
then,
you can go away from yourself. It doesn't matter. Whatever is easier. Everybody has whatever they feel is comfortable to them. Just make sure you're going from side to side. This, if you want to, you can do it this way. But you just want to go over very fast. Practice going one over the other slowly until you can speed that up, because going like that, it doesn't feel very comfortable. Sorry we're beating you up. But can you feel the difference as to what we mean as to making sure it's always in a rhythmic form? If not, it feels very choppy and uncomfortable. What's next up?
pinch.
Pinch. So when you pinch the side, especially on the back, you want to go,
These are your big crowd claws.
these are your big crab claws, correct. These are these. So you see how I'm pinching here? I'm pinching all of this. I'm not pinching this, I'm pinching this. About 3 to 4 inches.
Is it hand over hand again?
Nope.
Okay. How does that feel?
It's different compared to hers. It's more like you're pinching. Are you supposed to do it?
You have a little
your
pinch.
side or
Yeah,
your
you're
finger?
pinching. You're using your you're kind of using your whole hand. You're going to use your whole hand. Pinch, pinch. Pick it up. Pick it up.
Oh, okay, okay.
And so are we looking for the blood circulation too? Shouldn't this be turning red?
She is trying to. If you feel it, feel how warm she is. You may not visibly see it because right now she has a little bit of hives. So
Some people
Her
react
histamines?
more.
yeah, her histamines right now are. Are you taking Benadryl or anything?
Not right now.
Not right now.
Like I said, I have some Allegra if you want it. It's non-drowsy.
So we're not gonna use the face cradle when we're prone?
So does this
Again, what I said earlier, you can use it if you want
Yeah,
to. You can
compared
have
to
them laid to
hers.
the side.
does it feel like I'm wider? Or?
You're good. Just you're pinching once. You're pinching. You're trying to go linear
So both
linear
hands
across.
together.
No. Here, let's try this again. Like this. You do it a little bit fast. I mean, you want to see it move. You're pinching like this, like 1, 2, 3, pinch. You want to pinch. Even though my hand isn't going over, you want to do it a little bit more in a rhythmic form.
And so these are like all percussion movements too, to
Yeah, like that.
stimulate and tone.
Yes, to stimulate to tone. Yep, just practice that same movement and get up a little bit faster. Get in a little bit faster. All right, the next movement,
Effleurage.
the effleurage.
It's
The
not
finish.
The finish. Okay. Then we'll just finish just like this. Just kind of give us some love at the end.
Before the effluent noise is slap again.
No.
No,
You're perfect.
on her back, no, because we don't want to do too much. We don't want to go overboard with it. Again, these guys right here, this right here will tell you exactly the lower back and for the hips.
Okay.
They'll tell you the exact steps in the row for that. So now we've done the back. We're going to have her turn over, and now we're going to do the front. We're going to do her arms, we're going to do her legs, and then we're going to wrap.
So the arms are not until you flip back over.
It's a little bit easier when they're laying there. You have the full arm
Okay.
comparative to here, and if her face is not in a face cradle,
Yeah.
then she's laying like that, and that sometimes is very uncomfortable for people's heads. So, and you would only be able to get the back of the arm here. So that's why we have you turn around, and that's when we work on your front of the arm. Does that make sense?
Mm-hmm.
Okay.
How long do you have them wrapped up for?
The for a total of 20 minutes. That's with wrapping. That's with wrapping and putting it on the bandages.
Okay.
Yep. We're gonna go right there, and then hold on to this if you can, right through there.
No, she just messed up her towels too, flipping over.
No, she's
Under here.
she's
Is
okay.
that okay.
No,
Is it loaded up under your back?
I can't
Honey?
really feel it.
Oh, okay.
No, she's
Okay,
She's flat.
okay.
All right, put the arms there. We're going to do the same with the upper legs. Anybody want to try the upper legs?
You know
I'll
you
try
want
it.
to.
Come on over. For demonstration purposes, we're not going to leave the bandages on the full time. That we're just going to wrap them on and wrap them on. All right. Can we get a little bit more than that? Yeah. Get a little bit more than that. Do the effleurage. Again, you practice, you don't, I just want to be clear, you guys, do the movements, the stimulation, the moving up. You don't, if you put the bear claw first, that's okay. If you put the slapping, that's okay the second. We do have a specific way as to leading it up to that, and then at the end, feeling, you know, not so beat up, but it's okay. If you slap first and knead the second, it's okay. So we have the effleurage and we have the kneading. Great.
Knuckle and crawl.
Knuckling with the phalanges.
That feels good.
And we can focus on any, like, knots that we find at that time, or no?
No, you're not gonna have time.
No, just go for it.
And then after the legs.
Slapping.
Slapping.
Will you really pull your
So
hands?
pull-
The hand over hand stuff.
Yeah, you can do hand or hands. That's okay for you. And then
Okay,
sometimes
okay,
switch
okay.
up. See if it.
Yeah, it kind of feels
Everybody's
better to me
different.
that way.
Some people can go forward this way with their arms very good. Some people can go back this way. So get a little bit firmer with it.
Are we gonna make noise here?
You do want to make a little noise.
Okay.
She's not. There we go.
Okay.
That's what I want to see. Yeah. You're a little light with the fingers here. Yeah. Get more of a surface and more forehands together. There we go. How does that feel? You have to be honest. Good feedback.
Feels good, better than the one right here. The sound feels better.
You just have to get that rhythm.
Yeah. It is that rhythm.
Yeah.
Yeah.
You might be better pulling towards you. So
Yeah,
that might
true.
be you. Yeah. Get a little bit more. There we go.
Yeah, this is where we're getting the
Hand over hand.
and the edge of the hand in there.
Correct.
Okay.
I would suggest that maybe you try this leg.
Yeah.
Okay.
Okay. Next,
Bear paw.
bear paw. And the next one,
Slapping.
slapping.
Karate chop kind of
You
slap.
kind of.
Oh, that's with the edge of your hand.
Yeah,
Yes.
that's what the karate chop.
Okay.
Yeah. Pull towards you. Pull hand over hand. There we go.
Yeah.
I know it takes guys. It takes practice.
It made me feel like I'm
It's like I'm clumsy.
No, it's just
It's just new.
Yeah.
This is gonna be aerobic
Pinching.
for us.
Yeah.
Cardio.
Yeah.
It's a lot.
And
Sometimes
you
it's
can
a lot
move
easier
up,
to
or you
hand
can
stuff.
go from side to side if that matters. Sorry, I got that in my hand. And or you can move up if you want to.
Feels good.
All right, let's do the final effleurage. All right, let's do this other leg here. And then I'm going to do her arms and then wrap. That's just for time's sake for you guys all to get out on time. All right, there you go. No, no. What's next
Kneading.
up? Knuckle. Yep.
Knuckle crawl. There you go.
Oh, your hands are so cold.
No, you're fine.
Do I do it twice or do I?
No, okay, then stop. I wouldn't go over and over and over again. I would do one pass, then go back in with a second pass.
Oh,
And get more here, go here, and then go to the side, knuckling. Going right on the bone is a little bit more of a meat.
oh, now it's like real dry and tacky.
Mhm.
That's what it needs to be.
Really? Oh, okay.
Yeah, you don't, this is not slide, so nope, don't slide. Go 1, 2, 3. So
Oh.
you just want tacky, yeah. This is not a massage,
Okay.
This is a body treatment.
This is a bite, exactly.
Am I
And-
going back down?
Yeah, nope, you just go up,
Okay.
down,
and
go
then
back
slap.
second time. The next is
Slapping.
slapping. Put your hands together a little bit tighter.
Well, that is.
It's hard.
It's tricky.
So don't go back over a second, everyone, go back down, start again, yeah.
It would help if they go like that. Oops. That's just like, oh.
It's a little different. Keep your wrists a little bit tight. If you keep your wrists tight, that's a little bit easier than,
You got that down.
so you gotta keep your wrists tight. Like if you go like this, then it's like, what do I do?
Well, I feel like I'm sticking.
You are
You're
sticking.
supposed to stick.
You're
It
supposed to.
needs to stick. We're
Okay.
stimulating. We're
Right.
not relaxing. This is not relaxing treatment.
It's a percussion. This is a
Yeah, percussion.
Bear
yes.
paw.
Then do bear paw. There we go. Nope. So just long stroke.
We're not pinching. Just
We're not
long.
pinching. Yeah. Don't go over the areas twice like that. So just remember, just do this, just gently. Now we're calming her back down. We just got done beating her up.
Okay, so.
Just like, okay, let's calm back down the skin. This is like raking, and that doesn't feel very comfortable.
Are you going all the way into the adductors here, or? how
You
far do
can
go
if you
into
want
the
to.
adductors?
You can if you want to, depending on another comfortable level. Generally,
Slapping, beating.
it's not so comfortable.
Yeah, it's tender there.
I'll just stay this way.
Okay.
Just once.
That's it, and then let's, for time purposes, and what's the last one? Let's should we
Pinching.
up pinching.
Pinching.
Okay, so nope. So we're gonna do big,
Oh.
big. So use all four, and you're going to pinch like that. So go from the inside, then go to the top, and then go to the outside. We're gonna do pinch.
Sorry, tickle.
Ow! Yeah, so you're pinching.
She's really pinching.
Up, you're lifting up. So pinch.
More surface skin than meat.
More, yeah.
I just can't do that fast, I guess.
We're gonna practice.
See, I would practice that, especially for you. Yeah, so you need to pinch like that. This is side by side. This is not one over. This is side by side. So
Okay.
side by side, and just like you're laying down bricks, here, here, and here. You kind of go all over here. You're like, what's going on? You know,
Okay.
the body's like, okay, what is she doing to me? Do an arithmetic and do it like you're laying down bricks. Good. You got it.
Okay.
Good
Effleurage.
job. Good job. No, that was great.
Now, effleurage.
Now last is effleurage, like
Okay.
Deep
say,
effleurage.
Deep effleurage. Like, sorry, I got done beating you up. I will make this better.
There you go.
The
I don't wanna
drive
forget
doesn't
that.
hurt?
No.
I'm like,
It's-
oh,
it's
so I
supposed
haven't
to
even
be
read
very-
this.
It's not a
No.
massage. It's a body treatment.
Okay.
And then the next thing, so we should be done with that.
Yeah.
Now what I'm gonna do is I'm gonna quickly do her arms, and then we're gonna bandage her, and then we're gonna wrap
And during
her up.
this time, you normally do stomach as well, correct?
Yes. Thank you. We'll do the stomach next. This is stomach-wise. You guys pretty much know this one.
So it doesn't have arms on here, by the way. It doesn't say, it says lower
So-
left, lower right, but then it doesn't go into arms.
So
That's-
anything that you
That's
do
before stomach.
It's probably like the
It's
same
the
as the
same thing
legs.
as your legs.
is the same thing as your legs. If you take this one, this gives you the more in depth of it.
That's,
This is going to, yep, turn the page,
doesn't say
flip the page,
that it says
bust, and then what does it say after
upper
that?
limb.
Okay,
Upper
so
limb.
these are upper limbs. So we got upper limbs right through there. So
So we do that after the legs first.
you do the
So we're
legs
gonna-
first. Do the bigger part of the body first.
Okay, so I just wanna change the order then. So one is the limbs and then two, the upper limbs. Lower limb to upper limb.
Yeah, lower. Yeah. So if you look back on that page, it says back of body, left lower limb, and then it says right lower limb and thigh.
Okay.
So then we do body, and then now we're going to do stomach. I like to be as gentle as I can with the stomach. Not as- Everybody kind of has, we're going to do circular movements. When we do effleurage movements, circular movements. Remember, we want to do clockwise. We don't ever want to upset the digestive system by going counterclockwise. You can actually block up people that way.
Say that again, sorry.
Clockwise, you always want
Yeah.
to go clockwise. And then it should say, the next one should say effleurage strokes, release in the side of the stomach. So what we mean is release. We're doing just long, straight across. The next one is large pinching movements. Just stick to the sides. And how does that feel? Because this is where people tickle their shirt. This can be painful. If you pinch right there, if you get right there, that's very painful. So large pinching. We're just sticking to the hips area. Now come to the other side if you want to. And the large pinching area. Just mainly focusing on the hips and the sides.
So we're not, because on here it says stomach, so we're not doing stomach.
This is part of your stomach. This is part of your stomach. I'm saying just to localize in this area because pinching in this area does not necessarily feel
And it's gonna make him feel self-conscious.
exactly.
Yeah.
Exactly. So I'm saying stick to the sides
Okay,
of the stomach.
I'm gonna put, instead of stomach, hips.
You can
Sides
say
and
torso.
hips.
Torso. That's a good word. I gotta learn that down. Thanks. Torso. This is, torso. Even though this is considered the whole torso, this is just stick to the sides.
Okay.
And the next should be, again, just after we just get done pinching her, let's give her some love. Sorry. I do like to cover them back up because this is a large area that's exposed, even though we've warmed her up. Just for comfort.
It
Feels
gets a little
cool.
chilly.
Okay. Even with the heat. And the arms. When you're learning to practice, you're going to go through a lot of it. So just add a little bit more in. I'm just going to make a double batch. Add 152, the cocktail of 152. I put about 8 tablespoons in, and then I'm just going to do about 2 pumps for the remainder that's left.
Wait.
Half the batch of what we
She's
did
just
before.
half the batch,
I'm
baby.
just halving the batch right now because we just ran low, just from practicing,
It's just in case you need more.
just in case you
It's a
need more.
gullible 190 and 501.
Yeah.
So we're going to do effleurage strokes. We're going to do kneading.
You see that in the leg?
We're going to do slapping. Pinching. It's a little easier to do on the arm because you can almost get the whole arm. How does that feel?
Amazing.
And then we're going to do
Bear claw.
bear claw. Thank you. Bear claw. This feels really nice on the arms. And then slapping again.
Mm-hmm.
We're going to do more of that. This on the arm is a little tricky. 'Cause I don't want to hit her boob. So, and then effleurage.
Thank you.
I'm gonna do it this way so you guys can see so my back's not turned to you. Do effleurage.
Did you get a sunburn?
Hives.
Hives.
They're healing.
You had them all over, didn't you?
Do effleurage at the end, just for time's sake. All right, now we're going to do the bandages. I like to start with the midsection first. Even though it does say start with the legs first, I'm always conscious of people slipping. If I put these bandages on and I need her to raise her buttocks and her torso area, then they could slip. So I'd rather wrap this first and then do the legs and then completely wrap.
Okay, so the breast, the pectoralis muscles, would that be the last step before the wrap?
We're gonna avoid that just because a lot of people don't
Well,
like to.
I know, but in case we want to do it ourselves, that would be the last step you do.
No, so when she's wrapping, you'll see in that direction, you can do a neck and a décolleté massage because she's got some time when we're wrapping her. You've got some time to do a neck and a décolleté massage. What you mean for the breast area?
Mm-hmm.
Yes, if we were going to go back in, I'm not going to slap in this area.
Yeah.
So I just, again, we don't, for the
Just a
firming
smoothing-
techniques,
Smoothing across like that.
for the, after when they're wrapped, only when they're wrapped.
They
After
do
wrap,
that
okay.
figure eight.
Yeah, you don't want to do that. That it says the bust area. We are a French company. That's why it's printed in that. We're not going to do that. We're going to wrap her, and then you can do a neck, arm, and décolleté, and a scalp massage. And then when you unwrap her, everything is completed.
Because Americans are so weird.
Just a little different, yeah. They don't want
We're
this area touched. And
self-conscious.
that's fine. And we have laws, and it says otherwise that we can't touch it. So we're not going to touch it.
Actually, you can in Texas.
Oh, you can in
You
Texas?
have to have a sign. Both parties have to
doctor.
sign. No,
Well,
client and
their
There
nipples
is
have to be
some.
covered as well. I think, like, depending on the client and what they agree to.
Okay, so what I do with this, instead of side to side, we're going to gently lift up this way, and then we're going to wrap. So what I mean is by you're going to have the client, you have this towel that's right there. I'm going to ask you to lift up your buttocks, and we're going to have to work very fastly with this. So. Okay, to go ahead and lift up. And it's warm, but it's going to get cool very fast.
That seems a bit uncomfortable.
This is not
For
the
a
favorite
larger
part.
client, yeah.
For a larger client, then I would simply have them sit. Oops, sorry, it's hot. There we go. There we go. Now put your legs back down. For larger clients, this is what you're going to do. You do want to get this area here. That's the whole part of firming and slimming is right in this area. If they don't feel comfortable, then you're going to have them sit up. I'm going to have you hold your towel, place your towel right there. Hold them up, assist them by that, and then you're going to wrap around this way, but it's going to sit above. I want to show you two options. So around this way, or you could have them lift up their buttocks area. Can you lean on back?
Because I'm thinking a larger client, you're just not going to be able to wrap your arms around them and then under. It's going to be a little difficult.
The difficulty is them lifting up their hips. And in reality, it's difficulty for just anybody to do that bridge anyways. But we're French. They're a French-based company, so that's why they are. They want
I
it
think
size.
the hips are going to be easier to lift than them sit up. If they're
You
that
can't-
large,
Harley,
they
it's
might not
because we
have
do yoga,
abs.
that's why.
Huh?
That's why
Well, it's
yoga
only if
pose,
they're
it's
large,
actually-
that's if they're large, have to, because remember, see how she's wrapped right through the
Yeah.
hip area? It's, right underneath is that the area that we want to get.
Yeah, because
So-
more
Or they
people
can
think
lay
about
on their
toning and
side
firming their
and
butts.
walk
and
down.
stuff.
The laying on the side is even harder.
Yeah.
Yeah, laying on the side is even harder. So you can have them sit up and wrap it that way and push it down. Or you can have them lift up their hips
I don't
and
think
wrap it
it's
up.
that complicated, honestly.
What?
I don't think it's that complicated.
No,
No, it's not that hard.
bad.
It's just getting used to it.
It's getting used to it. Yeah, getting used to it. Next, we are going to do the leg. And I'm sorry when you did it. When she lifted up the hips, I needed to remove the towel. Sorry about that. Needed to remove the towel.
With that pen cover.
Is there a pin right there? Yeah.
Feel it.
Get the next one. And you're going to have them just bend their leg like this. Start from the top to the bottom. Look how these guys are hot.
Oh yeah, they
So
did.
now it feels like
Cool.
On this, it
Yeah.
says from the foot to upper thigh, so reverse
You can
that.
do one or the other. This is the reason why I'm telling you do it top to bottom,
Uh-huh.
because
You wanna make sure you get it all covered, right?
doing the toes at the end is a lot easier. Depending if they're long or if they're short.
Besides, this is the area you want for sure.
For
Yeah.
sure,
Yeah.
exactly. So if they're tall and all of a sudden I've got to stop right there, that's not exactly
Right.
so great. So I'm going to wrap this
Your
around.
mommy.
And you're not going to wrap it tight. I know it's getting a little warm at the end there.
That's okay.
This is just warm. Normally I'd say do one right after the other.
it gets colder.
Yeah, so that's why you got to work fast. Get that. We've done this leg. We're going to now try to keep her as warm as possible with that heat. And then go to the other side.
I feel like Chipotle.
You're gonna be like a little burrito.
Burrito.
Yeah.
That's what I tell people all the time.
You're making me hungry. already.
Yep,
You may
I'm
hungry.
gonna have you hold up this leg like this.
What?
Yeah.
Trying to cool it down.
What did
Oh,
you get
sorry,
for-
sorry about that.
It's okay, we could
Get a
just.
little wrap on us in the front. I
Huh?
love
Yes.
it.
Oh, I was just telling
Yeah,
you,
I love
Carly's
it.
asking me
I
if
do
it's
too. I
hot.
love it.
Yeah, it's hot,
I love
but
it.
it gets colder really fast.
That's the thing I love about yoga. It smells so fresh and good. It doesn't smell fake at all to me.
It's a little musky for me.
There's no perfume in it, it's all essential oils.
Exactly. That's what I'm saying. That's what I love about it. I was looking into other body treatments from another company. I was like, everything smells like plastic.
There's some that are really good and some that are
Bad. Yeah.
Why did you think
Then
this
we're gonna
was
slowly remove this towel. Like this. If you can put your arms in.
Send me the video.
Okay.
Have her put her arms in just like that. If they're claustrophobic, you can have
You too.
them
It might, it's not the best quality, just
No,
kind of dark,
no,
but
no, no.
put the arms out.
generally do.
I have to get going, but thank you so much
Okay,
for
absolutely.
everything. It was a pleasure meeting you.
No problem.
Later,
Bye.
Have a wonderful day.
Bye-bye.
Before we wrap, pull it all the way up, I'm gonna have her sit up. Remember, we didn't do her back. We didn't do her back area, did we? With the gobble.
No.
No.
We do that at the last, so I don't flip her back over.
Okay.
So actually, no, I take that back. We did do her back. Sorry, we did do her back.
Oh, yeah.
Put it back down.
We
Sorry,
did, yeah,
that's my fault.
we did,
That's my
yeah.
fault. Sorry. I'm thinking of the next step.
I have to say that we're probably going to do a different table setup.
What?
Yeah.
I said I'm going to have to say that we will probably do a little bit different table setup.
That's completely fine.
Yeah.
That's however you guys make it easier.
Yeah.
The film.
Do we have
you
any
guys,
thick
I think
blankets?
putting this on top.
No.
We can do it like this.
We could do just like the other setup, yeah.
We don't
No, but
wrap
we use the
the
blankets that we do
arms.
have. We
You
set
do
up
wrap the
blankets.
arms. Don't wrap them
I might,
individually.
I
no.
might do the
We're
same.
not wrapping this.
It's just three arms.
Just it's hips.
Similar,
Yeah.
but it's
It's
usually
similar,
not
but-
with the bulky.
Right.
Yeah.
Yeah.
I'll show you what we do.
Yeah.
Okay.
Whatever your guys' table setup is fine, as long as you have some kind of heat conductor, you have it on the bottom.
Right.
We recommend maybe putting it on the top so the heat goes down. Just at least having the one foam because those bandages are wet.
Right.
Doing that makes it easier than anything else.
Right.
So she's bandaged up, heat. I'm gonna do this because of time wise. I'm gonna take this off, okay?
And that takes 20 minutes.
It's
That
just
says
the-
20 minutes work on the décolleté and
the 10 minutes, like it's 10 minutes. This is gonna take you 10 minutes.
Yeah.
This is gonna take you 10 minutes. So about
Oh,
5
okay.
to 7 minutes.
Okay.
5 to 7, and then 10 minutes, 3 minutes is removal. So it's application,
Okay.
setting
That's
for about
20
10 minutes, and then removal at the same time. So 20 minutes total.
Okay.
So not just sitting for
So
20
really,
minutes.
yeah, so really not that long in the reps.
No, you're not that long.
Okay.
I mean, are you warm?
Yes, my back is warm.
Your back is warm.
Lower back.
Your lower back. What about this? This maybe because if we didn't have this on too long.
Right.
Does it feel cold?
Yeah, a bit. Can you put like a warm towel on top of it, or like on top of the? Maybe you
We'll
put
see
some
if we-
plastic
But I
on
think
it?
Well, I'm
If
saying
you're
if you took this off and you put the plastic on top and you wrapped her up a little bit tighter.
See, this would be
she's gonna
an
be
awesome
warm.
treatment, especially if we had hydroculators in all the rooms. Then you can just like put hydroculators on top with like some towels, and that will really just help to infuse the heat with the
Yeah.
with
If
the,
you
have a heat agent with it.
if you don't,
But
then
since we don't,
if you don't, then you
What
can.
What I normally do with the.
but not enough for
equipment
a treatment in each room, and we don't have enough space.
I put it over the plastic. I put the warm-
Hydroculate.
But it's also
on
hard
every
to.
room
They're
is
so
too
hot, and it's hard to like bring them
It
over
can-
in the room.
She said that it's not warm, and you want it to be, right?
It's not warm. She's also
getting warm now.
It's getting warm. Like if we let her sit for 10 minutes,
Then she'll be on.
Oh,
she's going to
break
be
the sweat.
warm. She's going to be warm.
Yeah, she's gonna.
I'm making sure this is like feeling
Yes,
heavy.
the foil
feeling
and-
something heavy on them, on the top makes them feel more comforting too. But if you're getting warm,
Yeah, the foil and stuff helps to heat it up. Like
I think the difference is whenever you cool the towel right before you put it on my leg versus it being warm and I'm like, oh my god, like I feel the heat. The
And
heat
you-
stays there.
yeah, you're gonna tell them it's gonna get. I mean, because as soon as the air hits it, it's going to start to cool off. So just say it's gonna apply warm. I'm gonna try to get. You have to work very fast to get them back to heated. So when you wrap, and then that's why put this on, and then only expose this leg, wrap, and then expose that leg. So now the same application goes, and we just do the final application of Gobble 190. You can keep it in your. Maybe we just hold on to this really quick. This, how you remove, this is why I suggest this being on top is, I've got to remove this. It's a lot easier to remove this underneath because she's been sweating in it. So we're going to, you literally keep her covered this way, and you're going to pull, just pull down, slide it off. But I want her to get out from underneath this wetness, so I'm going to pull this way. I'm going to take Gobble, this is not working very well, and I'm going to take Gobble 190, one pump, light treatment, just a light application. No, you're cold, huh?
Oh no, okay. I'm very chilled.
She's not hydrated. Not really.
No, I'm not.
Pull this off. I'm gonna throw that over there.
Now, this is gonna stay uncovered.
This is gonna stay uncovered. This is gonna stay uncovered because we're gonna finish up the treatment. She's pretty warm. Like if you feel her, she's very, very warm. Now, when I ask her to lift up her buttocks, we're gonna wrap and we're gonna pull everything out from underneath her. So I'm gonna have you lift up your hips. Correct.
Lordy, lordy.
There we go. Go ahead and sit back down. Okay. No. Sit down. Put your legs there. You can wrap up again if you want to. This is clean as long as she's not laying back in her sweat. That's the main key thing.
Oh look, I'm seeing now.
Alright. Bring it up right there. High in the stomach area.
When you wash this,
That might have gotten wet.
That's dirty, yeah. That's what she was sweating on. Then we're gonna conclude at the end, but we're gonna wait to put that gobble 190 on the back instead of having her sit up again, then come back for, oh, so sorry, then coming back for the conclusion. So, you energize, the Yonka energizing conclusion is, take a deep breath in. Grab the wrist. Take a deep breath in, point your toes, stretch. Excellent. Then I'm going to have you sit up. I'm going to help you sit up and punch on over forward. And then that's when I put the finishing of the gobble 190 at the end. And do a tree.
or should their hairs be tied up?
You
Oh,
can
you
give them a
can.
shower cap if
You
you
can,
want.
yeah, you can shower cap if you
Yeah,
want to.
shower cap.
You're fine, I mean, as long as you
Yeah.
tilt it to the
I was
side.
just asking to help them.
And then go ahead, and then the treatment is concluded. It just gets a little tricky.
Yeah, let's get that.